As it turns out, stem cells are an exciting new area. We're finding through at least 4 studies now that were done recently that stem cells may in fact be a cure to erectile dysfunction. We've been using them in the clinic with good results. Stem cells work in a couple of different ways. There are 2 types of cells in the penis that are most important to achieving erections. These are the endothelial cells and the cavernosal smooth muscle cells. Stem cells, when injected into the penis, can actually turn into those cells and thus regenerate what has worn out or is not functioning properly. In addition, there's some property to stem cells which allows the previous cells I just mentioned, that is the endothelial cells and the cavernosal smooth muscle cells, to, in a sense, talk to each other. It's called a paracrine effect. And that may be the biggest upside to using stem cells, is that communication between your body's own natural cells. Bottom line is, we're finding that not only in our clinic, but through these 4 studies and through this research, that stem cells may have long-term implications for improving erectile dysfunction.